A study of over 4 million pediatric hospitalizations by researchers at Dartmouth reveals a substantial increase in children hospitalized due to self-unaliving or self-harming behavior between 2009 and 2019. Mental health hospitalizations rose by 25.8%, costing $1.37 billion, with self-unaliving behavior accounting for 64.2% of pediatric mental health hospitalizations in 2019, up from 30% in 2009. The study highlights the inadequacies in the U.S. healthcare system for addressing this issue, with clinicians, crisis interventions, and insurers falling short. Factors contributing to these trends include growing social media use among social children and adolescents, which has been linked to increased depression symptoms. Experts call for more mental health care services in schools and community settings to reduce hospitalizations and address the central role hospitals now play as mental health providers. The study emphasizes the urgent need for intervention and improvement in mental health care for children and adolescents. Experts suggest that expanding access to mental health services in schools and community settings could lead to a decrease in hospitalizations related to self-unaliving and self-harming behavior. Additionally, they recommend enhancing mental health training for hospital staff, ensuring that they are well equipped to care for patients with these conditions. Experts call for hospitals to recognize the increasing importance of mental health emergencies and incentivize the addition of inpatient psychiatric units. Despite the financial challenges associated with low reimbursement rates for such units, their establishment is crucial for addressing the growing crisis. Efforts should also be made to improve early intervention programs and provide more comprehensive care for children and adolescents suffering from depressive, bipolar conduct, and psychotic disorders. By identifying and treating mental health issues in an earlier stage, the rates of self-unaliving behavior could be potentially reduced. It is crucial to address the role of social media in the mental health of young people. Parents, educators, mental health professionals should be aware of the risks associated with social media use and work collaboratively to develop strategies that promote healthy online behaviors and build resilience in children and adolescents. In addition to the aforementioned recommendations, fostering open communication and raising awareness about mental health issues among children and adolescents can play a crucial role in addressing the growing crisis. Parents, educators, and mental health professionals must work together to create an environment in which young people feel comfortable discussing their feelings, challenges, and emotions without fear of judgment or stigmatization. Schools can introduce programs that focus on teaching coping strategies, emotional regulation, and stress management to help students better handle difficult situations and emotional turmoil. This includes incorporating mindfulness exercises, meditation, and other relaxation techniques into the curriculum to help children develop skills that promote mental well-being. Collaboration between healthcare providers, insurance companies, and policymakers is essential for creating a more accessible and affordable mental health care system. By streamlining access to mental health care services, improving reimbursement rates for mental health care providers, and investing in early intervention programs, the systems can better address the needs of children and adolescents experiencing mental health issues. Another important aspect is the involvement of technology companies, especially those developing social media platforms, in creating healthier online environment for young users. By implementing features that promote mental well-being, raising awareness about the potential risks of excessive social media use, and encouraging responsible online behavior, technology companies can help mitigate the effects of social media on mental health. Overall, tackling the rising rates of self-unaliving and self-harming behavior among children and adolescents requires a multifaceted approach involving various stakeholders, including parents, educators, mental health professionals, healthcare providers, insurance companies, policymakers, and technology companies. By working together, these stakeholders can create an environment that fosters mental well-being and effectively addresses the needs of young people experiencing mental health challenges. Addressing the rise in self-unaliving and self-harming behavior among children and adolescents, although challenging, presents an opportunity for positive change through collaborative efforts from various stakeholders. By focusing on prevention, early intervention, and providing a supportive environment, we can create a brighter future for young people. Schools can take the lead in promoting mental well-being by integrating mental health education into the curriculum, teaching students about the importance of self-care and fostering open communication. By equipping students with coping strategies, emotional regulation techniques, and stress management skills, they will be better prepared to navigate life's challenges and maintain their mental health. Parents, too, play a crucial role in providing a nurturing and supportive environment for their children by engaging in open conversations about mental health and seeking professional help when necessary. Parents can help break the stigma surrounding mental health issues and ensure that their children receive the care they need. Mental health professionals and healthcare providers can contribute positively by advocating for better access to mental health services, engaging in community outreach programs, and collaborating with schools and other organizations. As a result, they can help create a more accessible and effective mental health care system that meets the needs of children and adolescents. Technology companies, particularly those involved in social media, can also make a positive impact by promoting responsible online behavior and implementing features that support mental well-being. These measures can help mitigate the negative effects of social media on mental health and create a healthier online environment for young users. Policymakers can play their part by investing in early intervention programs, allocating resources to mental health services, and supporting initiatives that promote mental well-being in schools and communities. By prioritizing mental health, policymakers can help drive positive change and create a society that values and supports the mental health of its young members. With a concerted effort from parents, educators, mental health professionals, healthcare providers, and technology companies, don't forget policymakers, we can create a positive environment that fosters mental well-being and empowers children to lead fulfilling, healthier lives. By working together, we can make significant strides in addressing the challenges associated with self-unaliving and self-harming behavior, and pave the way for a brighter, more hopeful future for our youth. And of course, this is coming on the back of the tragedy that happened in Nashville. Hearts go out to the people who lost loved ones